Hello, this is Dr. Wiafi, and in this video, I would like to discuss GIS in public health practice. We will start by defining what public health is. We'll also try to link people and places. Then we will define public health practice and review geotechnologies and how GIS in particular can enhance public health practice. The main goal of this course is to explore the process of integrating geospatial technologies, particularly GIS, into the standard framework of public health practice. There are three objectives. One, to develop an understanding of geospatial data infrastructure and how to produce location-based information to enhance public health. Second, to identify the relevant spatial characteristics of diverse application areas, enabling health professionals to integrate spatial thinking and GIS analysis into their careers. This is an area that is really not growing as fast as it should. The number of public health professionals that do not have a full understanding of how GIS can enhance their careers. Third, to have the ability to use geospatial technologies to gain a significant advantage in the information technology field. So, what is public health? According to Charles Edward Amory Winslow, who was a leading figure in the modern study of public health, defined public health as the science and the art of preventing disease, prolonging life, and promoting health through organized efforts and informed choices of society, organizations, public and private communities, and individuals. Note the influences on the broader societal and community levels as well as individual levels. I think to best understand this, let's look at what public health professionals do. Public health professionals have a number of roles that they play. They prevent epidemics and the spread of diseases, protect against environmental hazards, promotes and encourages health behaviors and injury prevention. Public health professionals respond to disasters and assist communities in recovery. They also assure the quality and accessibility of health services. In fact, we live in an unprecedented time now with coronavirus pandemic. And I think this is the time that public health professionals need to shine to the occasion. Because prevention is the key. And that is exactly what public health professionals do. The mission of public health by the institution of medicine states that the mission of public health is fulfilling society's interest in assuring conditions in which people can be healthy. Similarly, the World Health Organization stresses that public health aims to provide maximum benefit for the largest number of people. Therefore, public health focuses on groups of people rather than just an individual. At the core of public health lies the principle of social justice, providing people the right to be healthy and to live in conditions that will support their health. So there are some key terms that we need to get acquainted with. We know what public health is now, right? So let's review some common key terms. Clinical care, determinant, epidemic or outbreak, health outcome. I'm not going to read all these, but I want you to be acquainted with these definitions because they are going to play a very important role in our GIS for public health practice activities. So let me just bring in, as I call it, a point of view. There is a world of public health practice, and there is a world of geography and spatial considerations. GIS connects the two, and the way it connects it is actually by way of epidemiology. Because epidemiology deals with the study of people, places, and time. In fact, if you have taken a basic epidemiology course, you are going to learn that diseases are characterized by person, place, and time. Now, notice closely how they are aligned together. Because these three dimensions are connected together with data, which has spatial commonality. And that is what we are going to deal with in this course. So then, what is public health practice? Public health practice has a number of definitions. And you are going to learn some of them today. And in the course of the course, you are going to learn more of it. But the classic definition of public health practice is actually from the Association of Schools and of Public Health and Programs in 1999, which states that the strategic, organized, and interdisciplinary application of knowledge, skills, and competencies necessary to perform essential public health services and other activities to improve the population's health constitute what public health practice is about. Public health practice is linked to the core functions of public health. It is cyclical and continuous process. It is managed by systems level and enhanced through active research. So the functions of public health are assessment, assurance, and policy development, which are carried out in the field as a function of government to provide health services. This implementation is done through programs and services with the sole objective of improving public health. So we can look at different definitions of public health practice. Assessment, assurance, policy development, which are carried out in the field as a function of government to provide public services. Another definition is the real effect, where in common sense, we will say where the rubber meets the road. In actuality, applying all the science, knowledge, experience to our public, evaluating, measuring impact on health. Public health practice can also be defined as the application of proven tools, interventions that generate a positive health outcome. Public health practice can also be defined as the application of public health science at the delivery level. It can be federal, it can be state, it can be local. The application results in services to the public and better health status. We can also look at it from the essential public health services. There are 10 of those. So the application of the 10 essential services through the broad public health system, policy development should be driven through shared leadership, translation of policy into practice, implementation of evidence-based science into interventions. So there are several definitions that we could dwell on. So let's look at the core functions of public health. The assessment, policy development, and assurance. The assessment deals with the regular collection, analysis, and sharing of information about health conditions, risks, and resources in a community. Through assessment, trends in illness, injury, and death, and the factors which may cause these events can be identified. Under policy development, information is gathered from assessment activities, which is then used to develop local and state health policies. This process includes information sharing, citizen participation, compromise and consensus. Policy development includes consideration of political, organizational, and community values and foster shared ownership of policy decisions. Assurance. Assurance means making sure that needed health services are available. Assurance focuses on maintaining the capacity in public health agencies to manage day-to-day operation and provide the core public health functions. This function also requires monitoring the quality of health services provided in both public and private sectors. In all this, geography matters, because when it comes to health, it's not just who you are that matters, it is also where you live. So for that reason, then the key technologies that we will be considering are remote sensing data, global positioning system, GPS, geographic information system that you are familiar with, surveying and mapping, and web GIS. So simply put, GIS becomes a tool for delivering information from any data with a geographic spatial component. So how can GIS help in assessment, assurance, and policy development? The role of GIS in public health practice is promising. Spatial thinking, spatial solutions, affirmation that geography matters when it comes to health. These are timely and effective in management and saving of life. You see, better healthcare management and greater scientific exploration in public health decision making is made possible through GIS. And so on this slide, I've provided a few examples of how GIS can be used in public health practice for a changing world. For instance, in assessment, public health programs and services can be evaluated over time and location. In policy development, the geographic distribution of public health needs can be analyzed, enabling programs and resources for specific public health issues to be directed to the locations of greatest need. And in assurance, GIS can be used to evaluate effectiveness, accessibility, and quality of personnel and population-based health services, and the effect of services on selected preventable health outcomes. So what's so special about geospatial technology? There are three reasons. Number one, geographic problems involve an aspect of location, either in the information used to solve them or in the solutions themselves. Two, almost everything happens somewhere, and in most cases, knowing where geographic location happen is critically important. Three, everything is related to everything else, but near things are more related than distant things. I would like to remind you that public health GIS started a long time ago. In fact, geographical analysis is part of public health tradition. We can trace it way back to 400 BC during the time of Hippocrates. John Snow in the time of 1850s, where he made epidemiology come live. So what we can say is many public health questions are related to space. So in 1854, Dr. John Snow mapped cholera outbreaks in London. He first identified where people lived who were infected. The cluster pattern suggested a particular water pump was the source. And he made maps to show the location of cholera cases in relation to water sources. Since then, maps are increasingly being used in public health to communicate information such as the global transmission and spread of diseases. Today, we use modern technologies to create maps, but in those days of Dr. John Snow, maps were being done with the hand, in the manual way, and that has not been easy. There are modern way of showing disease outbreaks. The health map can give you a broader view of disease outbreaks around the world, and more specifically, the COVID-19 that we are dealing with currently can be viewed online. And the impressive map that has been developed by Johns Hopkins University is what is actually tracking the cases globally. Here are examples of health industries that use GIS. In fact, I must say that this is just a selected sample of health industries that are using the technology: public health, epidemiology, health and hospital administration, healthcare policy, environmental justice, medical research, insurance agencies, homeland security, emergency response, and disaster management. We can also see it being deployed in healthcare administration. In fact, healthcare is in part controlled by geographic location, and we can see a number of benefits that can be acquired from using the technology. And in public health, we have several organizations that use GIS to map data. We facilitate assessments on a variety of issues, including diseases and epidemics, air and water quality, sanitary conditions of food handlers, vital events such as birth, death, and immunizations, readiness to respond to natural disasters and man-made disasters. You can also see it being used in assessment of effectiveness of and outcomes. In these cases, there are some geographic challenges that we will be dealing with in the course of this course. We can also use the technology for resource allocation events. For instance, we can examine the spatial distribution of health resources and health needs. We can also use it for risk assessment. In fact, most public health evaluations and assessments do not take into account that there may be spatial autocorrelation in the data. This means that the observations may be less independent than we think. The most basic assumption in statistical analysis of health data is that we have a sample of independent observations of the phenomenon that we are studying. Although this may not be the main focus of this course, there are techniques of spatial analysis that allow us to account for the spatial dependencies in our data. Several examples can be seen. For instance, reversing the obesity epidemic. GIS can help public health agencies and researchers to address the obesity epidemic. In health insurance, GIS can be used to understand the percentage of uninsured people by age. Medical research, GIS has become a tool for organizing and analyzing health outcome data or spatial analysis data. GIS is a valuable tool for organizing and analyzing health outcome data, estimating environmental exposures, and displaying research results. Spatial analysis of data that shares a common location reveals hidden patterns and relationships that are not apparent in spreadsheets or statistical packages. We can also use GIS to look at cancer mortality rates, especially in different racial and ethnic groups. Recently, GIS is being used for homeland security and disaster management issues. Real-time system for reporting, early detection of syndromic surveillance, efficient tracking mechanism, scenarios to prepare for threats and emergencies. These are all being used as we speak. And we are going to look at some of those and how we can apply them in our public health practices. There are other agencies that are also using GIS, and this slide gives you a snapshot of some of those organizations and how they are using them. More recently, GIS is being shared through the use of web maps, and I'm sure some of you, if not all of you, are familiar with HGIS online through story maps and all kinds of apps that can be created. So moving forward, in this course, the rest of the course will be devoted to exploring the role of GIS in more detail, focusing on its application to the core functions and essential services of public health. Thank you for watching, and look out for different examples and the different scenarios by which GIS can be used in public health. Thanks.